Students of class 12th, our previous topic was birth control, which we have not completed yet. Now we will discuss again tomorrow regarding the remaining birth control measures. We were discussing IUDs. IUDs means intrauterine devices. Intrauterine devices. These are the devices which are fitted into the uterus of the females so as to prevent implantation in the uterus. These are intrauterine devices. These intrauterine devices also can kill the sperms by releasing some harmful chemicals, like there are the intrauterine devices, copper releasing इंट्रायूट्रीन डिवाइसेस कॉपर रिलीजिंग आयोडीज जिनको हम कहते हैं copper releasing iodines, like there is copper T and there is multi-load 375. These are copper releasing iodines. There are some iodines which are known as hormone releasing iodines. Hormone releasing iodines, which can release the hormones which are effective to limit the conception, like there is the hormone releasing iodine which is known as LNG20. LNG20. Another is progestasert. Progestasert. Hormone releasing iodine. LNG20 and progestasert. Now, there are also some oral contraceptives. Oral contraceptives. There are also some contraceptives which are taken orally, which can also prevent conception. For example, these are also known as oral pills. Oral pills are oral contraceptives. These contain the chemicals, these contain the drugs which can prevent ovulation, or they can prevent implantation. They are taken from the first day of the cycle, or within 4 days of the cycle. They are taken up to 21 days. They are taken regularly for 21 days, and then there is a gap of 7 days. Gap of 7 days, and again for 21 days. Gap of 7 days, again for 21 days. It is continuously taken for 21 days. Now there may be two types of oral contraceptives: mini pills and combined pills. Mini pills and combined pills. Mini pills contain only progesterone. Progesterone, also known as progestin. They contain only progesterone, but the combined pills contain progesterone and estrogen. Progesterone and estrogen. OES, estrogen. प्रोजेस्टेरोन भी होता है इनमें, एस्ट्रोजन भी होता है. They are known as estrogen. ESTROGN. Estrogen is the name for the combined pill containing progesterone and estrogen. 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 Many pills and combined pills. These are the two types of oral contraceptives. Now, the mini pill की example है साहिली. Sahili, which has been developed by the Central Drug Research Institute, Lucknow. Central Drug Research Institute, Lucknow. CDRI, Central Drug Research Institute, Lucknow. उसी ने ये साहिली डेवलप की है. And example for combined pills are Maladi, Maladi, Mala N. Maladi and Mala N are the combined pills taken as the oral contraceptives, orally taken. Now, there are another measures which are known as subcutaneous implants. Subcutaneous implants. Subcutaneous implants means these are implanted subcutaneously. These are implanted under the skin, under the अपर आर्म, इनर आर्म, इनर आर्म में ये फिक्स किए जाते हैं अबाउट 6 मैच स्टिक साइज्ड कैप्सूल्स, मैच स्टिक साइज्ड कैप्सूल्स, match stick sized capsules, and they are very effective and they can be taken for a longer period. Subcutaneous implants are the match stick sized capsules, 6 in number, which are fixed under the skin on the inner arm, which can limit the consumption, which can control the consumption. Now another method is which is known as hormonal injection. Hormonal injections are there. The hormones are injected and to prevent the ovulation. For example, they are known as Depo-Provero, 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 Depo-Provero. These are the hormonal injections. They are taken after every 3 months. After every 3 months, these hormonal injections are administered so as to prevent conception. Depo-Provero hormonal injection. Now there are so many other measures. There are morning after pills, morning after pills, morning after pills, morning after pills, also known as emergency pills. Emergency pills. It is not taken in the morning as the name indicates, morning after pills, but these are the emergency pills when there is unprotected sexual intercourse and after sexual intercourse up to a period of 72 hours, if these pills are taken, they can prevent conception. If these pills are taken within 72 hours after intercourse, unprotected intercourse, they can prevent the conception. There will be no the conception. These are therefore called morning after pills, emergency pills, as we feel that the intercourse is unprotected and there are the chances of pregnancy. At once, the morning after pills are taken after 72 hours and they can control the process. Now, the morning after pills may be eye pill. Another is pill 72. Another is unwanted 72. Unwanted 72. Unwanted 72.